Recently, a federal judge issued a preliminary injunction against Health and Human Services Secretary Xavier Becerra from enforcing new rules regarding COVID-19 vaccine and mask mandates in Head Start programs. Now, while this is good news for liberty in America, it also hides a terrifying secret. You see, more and more America is being run less like a constitutional republic, but more like a kingdom or an oligarchy instead, where those in positions of power merely dictate to the rest of us how we live our lives. The case Texas versus Becerra is not over, and neither is the need of the American people to rein in an out-of-control government in Washington, D.C. So we'll discuss that next on the Constitution Study.
There's one thing you have to know wherever you make your stand. Came from a long through line of everyday Americans.
Hello there, everyday Americans, and welcome to the Constitution Study. I am glad you could join me. Please head over to the website constitutionstudy.com, that you can find the written article, all my articles, my videos, my podcasts, links to my radio program. You can sign up for the newsletter, you can ask questions, you can buy things off the store, all starting there at the Constitution Study. And I'll talk more about what we can do at the end of the program, but for now, let's talk about this case of Texas versus Becerra. On the last day of 2021, Judge James Wesley Hendricks issued an order enjoining Secretary Becerra from enforcing HHS's Head Start mandates. As stated in the order, he did so because the court believed there is a substantial likelihood that the Head Start mandates is not within the scope of the legislation that created Head Start, that HHS failed to follow proper rulemaking procedures, and that the mandates are arbitrary and capricious. Now, while Judge Hendricks' order is limited to the state of Texas, it is another proof point of the dictatorial nature of the federal government. For that, Judge Hendricks should be praised. However, as I was reading the judge's order, I realized we are here because for decades the American people have stood by while those in Washington, D.C. crept ever more toward a tyrannical and dictatorial style of governing. Even worse, many Americans were either complicit in the bribery that is Head Start or conspired with it because it made them feel good for doing something, while not doing anything except to steal from the American people. Now, an outgrowth of President Johnson's war on poverty, the Head Start program had a laudable goal. The Head Start program began as an 8-week demonstration project designed to help break the cycle of poverty. It provided preschool children from low-income families with a comprehensive program to meet their emotional, social, health, nutritional, and educational needs. Why is it, whenever anyone says it's for the children, so many Americans are unwilling to challenge governmental overreach? I'm not saying that a Head Start program is good or bad, but it is outside of the limited powers delegated to the United States by the Constitution. Head Start, and now Early Head Start, are federal programs governed by the Head Start Program Performance Standards. The Head Start Program Performance Standards, or HSPPS, the regulations governing Head Start programs, were originally published in 1975. In 1995, the first Early Head Start grants were awarded to several low-income pregnant women and children ages to birth to 3. In 1998, the Head Start program was reauthorized to expand to full-day and full-year services. The Head Start program to include Early Head Start was most recently reauthorized in 2007 with bipartisan support. There is nothing in the Constitution that delegates to the United States the power to regulate education. It isn't interstate commerce, and it's not for the general welfare of the United States. This program is designed to benefit a segment of society, which I've already said is a laudable goal. But since this power was never delegated to the United States, it remains with the states. That makes the Head Start program and those who voted for it guilty of embezzlement, which is defined as the fraudulent conversion of another's property by a person who is in a position of trust, such as an agent or employee. They have converted your money into this program without your consent. They did so willfully in order to gain the image of being charitable for the purposes of improving their chances for re-election or the re-election of their colleagues. The federal government now uses their ill-gotten gains to extort state and local officials to comply with their desires. From the opinion in Texas versus Becerra. The Department of Health and Human Services offers grants to schools, nonprofits, and other local organizations to run Head Start programs. In response to the COVID-19 pandemic, the Office of Head Start allowed local providers to adjust their services as necessary depending on community conditions and needs. Did you notice the shift? First, HHS offers grants to organizations that run Head Start programs. Then they claim the power to allow those programs to adjust their services. This is where HHS's Head Start went from simple embezzlement to extortion and even racketeering, which is traditionally obtaining or extorting money illegally or carrying on illegal business activities, usually by organized crime. By allowing programs to act a specific way, HHS was claiming the authority to regulate a state or local education program directly. Notice, according to the case, HHS didn't simply state that their grants would only be available to those who comply with their wishes. They demand that anyone who has taken their money comply with their new rule. Head Start grant recipients are required as part of the IFC, the interim final rule with comment, to maintain records on staff vaccination rates. Additionally, Head Start programs are required to develop their written SARS-CoV-2 testing protocols for current infection for individuals granted vaccine exemptions. While I could not find any specific language in HHS's rule to this point, my guess is that not only would future grants be withheld, but suits may be filed for the return of existing grants for noncompliance. The question before this court was simple. It is undisputed that an agency cannot act without congressional authorization. Thus, the question here is whether Congress authorized HHS to impose these requirements. HHS claims that the mandates are authorized as program performance standards related to administrative and financial management, the condition of facilities, or such other standards the agency finds to be appropriate. Before the question of congressional authorization should be the question of a constitutional one. Since the judge apparently did not ask this question, let us set it aside temporarily and look at what Congress authorized HHS to do. Now, as is so often the case, the devil is in the details. For example, in the suit, HHS claims that the mandates are authorized as program performance standards. However, the law is a bit more detailed. Under subsection A1, the Secretary shall modify, as necessary, program performance standards by regulation applicable to Head Start agencies and programs under this subchapter. Since the Secretary cannot simply authorize changes, they must be done by regulation. Federal law requires that such regulations go through a detailed process to ensure not only the legitimacy, but to gather the public sentiment on the idea. Next is the question of the Secretary's power over the administration and financial management of Head Start programs. Now, included within the list of the Secretary's power to modify are administrative and financial management standards. This means the law did not give the Secretary the authority to regulate the administrative and financial management of Head Start programs, only the standards by which they work. Now you may be asking yourself, what's the difference? Well, under HHS's view in the suit, the Secretary can regulate the actual management of these programs, where Congress only allowed him to set standards for administration and financial management. But what about standards about the condition of the facilities? Well, subsection D. Standards relating to the condition and location of facilities, including indoor air quality assessment standards, were appropriate for such agencies and programs. Now, HHS claims the Secretary has the authority to issue these mandates under subsection D of the law, but that deals with the condition and location of the facility, not to impose medical standards for the students and staff. Of course, the agency's last trump card is subsection E. Such other standards as the Secretary finds to be appropriate. Game, set, and match, no? See, if the Secretary finds the standard appropriate, he can do whatever he wants. Except the law also includes things the Secretary must consider when developing those standards. In developing any modification to standards required under subparagraph 1, the Secretary shall A. consult with experts in the field of child development, early child education, child health care, family services, including linguistic and culturally appropriate services to non-English speaking children and their families, administration and financial management, and the persons with experience in the operation of Head Start programs. And then under subsection C, item 1, review and revise as necessary the standards in effect under this subsection, and item 2, ensure that any such revisions in the standard will not result in the elimination of or any reduction in quality, scope, or types of health, educational, parental involvement, nutritional, social, or other services required to be provided under such standard as in effect on December 12, 2007. I don't know about you, but when the CDC's data shows that children under 5 are less than 3% of the cases and have a statistically 0% death rate, I wonder what experts Secretary Becerra has been consulting. And since these mandates reduce parental involvement along with social, educational, and health quality, I think the Secretary has missed the boat on this one. Now, before the judge made his decision, both parties had a chance to argue their cases. Reading from the opinion. During oral argument, counsel for the defendants made multiple concessions relevant to the court's analysis. First, she noted that the vaccine and mask mandates are not health services within the meaning of the Head Start Act. Second, she explained that the agency does not assert that the rule was or could be authorized under 42 U.S.C. 9863A1A, which are performance standards with respect to services required to be provided, including health services. Third, while she continued to argue that the rule could be authorized as an administrative standard under subsection C, she admitted that it could not qualify as a financial management standard. And finally, she admitted that while other health services made available to children by Head Start are strongly encouraged, this is the first time that Head Start has mandated a medical procedure as a precondition to new or ongoing employment. The rule is unprecedented, although counsel asserts that it is justified by an unprecedented pandemic. In short, even the attorney for Health and Human Services could provide no justification for the rule other than we're in an unprecedented pandemic. While COVID-19 has spread globally, I would dispute the statement that it's unprecedented, since there are many other viruses around the world with a medical impact as great or greater than SARS-CoV-2. Things, however, did not go all Texas's way. From the opinion, counsel for Texas likewise made an important clarification during the argument. Regarding Texas's request for a national injunction, he admitted that the Fifth Circuit recently limited a nationwide injunction and that relevant precedent on the topic appeared inconsistent. He agreed that the great majority of evidence before the court was limited to the mandate's effect on Texas and school districts in Texas. He explained that Texas's request for nationwide relief was not based on case law, but rather the Administrative Procedures Act, which instructs courts to set aside unlawful agency actions. While claiming that because HHS violated the Administrative Procedures Act, Texas claimed the mandate was not only a violation in the state of Texas, but nationwide. Now, since courts have shown a slavish devotion to case law rather than the Constitution, this judge limited the scope of his injunction to Texas. The court found that the state of Texas demonstrated a substantial likelihood they would win the case on the merits of 4 specific claims. First, that Secretary Becerra issued the rule without statutory authority. Second, that Secretary Becerra did not follow proper rulemaking procedures. Third, that the rule is arbitrary and capricious because it is unreasonably overbroad without reasonable explanation. Lastly, HHS could not show that there was sufficient threat of irreparable harm for them to receive relief from the injunction. Now, those in Texas should be happy, at least for now, that their children and the staff at Head Start programs will not be subject to the same draconian regulations as other aspects of our society. Parents won't have to choose between having their children experimented on or utilizing a program funded by their tax dollars. Staff will not have to choose between being a guinea pig or being unemployed. I believe all Americans should learn a very important lesson from this. When you use government to do what it is not authorized to, you open a Pandora's box of tyranny and subjugation. Before we allow our employees in government to approve legislation, we should first imagine it being used by our most hated enemies against us. We should look at how it may be warped and twisted into a power beyond what we intended. Only then, when we are comfortable with the possible outcomes, should we approve its passage. Otherwise, the legislation needs more work. So I am happy for the people of the state of Texas. They won their injunction. The case still proceeds, and I'll follow it and see what happens. But notice, this all started because the people sat back when a government agency, a federal agency, was created that's beyond the authorized scope, a power delegated to the United States, gave it power to make decisions beyond what the Constitution authorized, then never punished for going beyond their scope of interest, their authorization by Congress, and then we're surprised when they keep doing it. So this particular decision is good news. But like going to the doctor for a cough and finding cancer, this case has exposed a much deeper and more serious problem. And it truly is up to we, the American people, to once again regain control of Congress and the executive branch. As James Garfield said, now more than ever, the people are responsible for the character of their Congress. If it be ignorant, reckless, and corrupt, it is because the people tolerate ignorance, recklessness, and corruption. I say that applies to all of our governments. See, if HHS and Secretary Becerra are ignorant, reckless, and corrupt, it's because we tolerate it. Then you may be asking, what can we do, Paul? We didn't appoint him. No, but he was approved by representatives of your states that you people voted for. Maybe not individually, but you and your neighbors voted for your senator. Did your senator vote for or against Secretary Becerra? Did your state appoint electors who voted for President Biden or not? As a whole, we've chosen this president. We approved of his pick for HHS secretary. The buck stops here. The fault ultimately is ours because we have tolerated corruption so long, we're used to it, and it's time to change. Now, one way to change is to read and study the Constitution. As John Jay said, by knowing their rights, they will sooner perceive when they're violated and be the better prepared to defend and assert them. That's what we do here. Again, check us out at constitutionstudy.com. There's lots of information for you to use and lots of information for you to share. All of that is absolutely free. In fact, I ask you to share it. Now, yeah, there's stuff you can buy on the store, but all of my articles, all my videos, everything you find on the Constitution Study is free. Now, there's more you can do. See, I'll be starting up my Constitution Study soon. So if you want to register, if you want to find out more, if you want to register, go to constitutionstudy.com/study. You can read what we'll be doing in the study, and you can sign up. I haven't set the date in stone yet, but it's looking like Monday evenings every other week. Now, if you can't join Monday evenings, don't worry. You can still sign up and watch the recordings. I'll be recording these Zoom meetings, and I will be posting them on the Scholars website, so you can follow along, and I'll still have the opportunity for answering questions and stuff like that up there. So that's a possibility. Speaking of the Constitution Scholars, please check it out, constitutionscholars.com. I set it up for students. That's what a scholar is, a student. It's a place for students to get together, to share information. You have access to an online library, some classes and videos that I've done, and groups. I've created a group for each state, so join your state group. Find others in your state that are interested in learning about the Constitution. It's a place for you to go, share information, share ideas, make friends, become a community. You can also sign up for the paid mentoring program if you want to go farther. That's where the Scholars goes beyond simply meeting and greeting, where there are classes for you to become a better scholar, a better student. A lot of those classes are still being added to, so it's a great opportunity. Again, you can find out more. Again, you can find out more at Constitution Scholars. Most of all, regardless of how you go about doing it, become better educated about the Constitution, about the United States it created, the government it created, and your responsibilities, not just your rights, but your responsibilities as a citizen in a constitutional republic. And then please join me here next time for the Constitution Study.
There's one thing